another exciting time for us on your number one health program, reaching you from the station of excellence, NTA Lagos Channel 10. It's Health Watch, and this week we're talking about a whole lot of things. First on our lineup is child survival. Last week we talked about breastfeeding. After that stage, you move on to the stage of trying to ensure the child is very healthy. And Mohammed Okori, an officer with UNICEF, was able to identify the basic things we should look out for in ensuring that our children stay healthy. And this is to all parents, to all mothers, of course. Moving on, we have something on the benefits of medical checkup, regular medical checkup. Achoze Elizabeth, a public health analyst, was able to tell us the consequences of not checking out your health regularly. You should see that interview. Plus, we have something on menopause. Dr. Mosumola Dosumu, in this particular interview, was able to prepare women with the right knowledge, the right information. You need to prepare yourself for that. This stage must come, all right? Menopause must come for women. It's just like the puberty stage. These are stages of life that we must pass through. All of these are more on this week's edition of Health Watch. We'll go on a short break now. When we return, Health Watch continues in a moment. My name is Nkem Okibe. Stay with us.
Me, I feel say family planning. He help husband and wife for good health so that at least they can last. And in the other way around, now to allow the woman and the man to have the children that they can be able to train.
Family planning na-enyelu di na nwunye aka ka ha dị ime oge ha chọrọ.
Family planning tank pe ni to mo bibi ni pe ki àwa àti ọkùnrin àti obìnrin kò yẹ ká bí mo rẹpẹtẹ ju tí tá para wò ní ká lọ. Tá bá máa bí ó jẹ́ méjì mẹ́ta ká bí.
Ya kamata su yi family planning saboda suna rage samun damar ‘ya'yansu su ƙara girma kamin su samu wasu ‘ya'ya su zo gare su. Idan suna yin family planning za su samu sauƙin abin nan gare su. Saboda haka ne ake mutane gargaɗin cewa su continue da ko mace wanda yana da mata ya yi matan shi ta je ta yi family planning saboda ta samu sauƙin ‘ya'ya haihuwa.
Improving the survival chances of newborns, children and mothers is an urgent global challenge. In Nigeria, it is a major concern and contributes about 13% of the global under-5 mortalities.
Now, child survival encompasses a whole lot of things. One is, it actually even starts from before the child is born. How many antenatal care services did the mother go to? You know? And as soon as the child is born, the next thing you'll be talking about is the child introduced to the first responsibility of the mother, which is introduction to the breast milk. You know, the colostrum, it was administered immediately. Then you talk about exclusive breastfeeding for the first 6 months of life. From there, you now move on. While that is happening, you are now beginning to think about other things. And so many other things start, like when it gets to the time the child has to now, be introduced to other infant feeding options. What is the level of hygiene? What kind of water? How clean is the water? How clean is the environment? What about the vaccines, different antigens that the child has to take? So you begin to see that all these begin to form some of those subs that fit into what makes a child survive.
Child survival is a critical element of socio-economic and health indicator of a country. Several efforts have been put in curtailing preventable death. Mohammed Okori is a social policy manager with UNICEF. He tells us workable strategies that will aid child survival, especially in a city like Lagos.
If you come to a state like Lagos, the first question you ask is, what are the policies you have on ground? What policies and programs? And the fundamental aspect of it is, whatever you do, is it in the best interest of the child? Because that's the most paramount. If everything you do is in the best interest of the child, then you begin to now see partners. Because even part of the SDGs is partnership. Because you can't do it alone as government. Individuals have to come in, parents have to come in, communities have to come in, and we all play roles. You also see that everybody is involved. the parents, the communities, the grandmothers, the traditional institutions, the religious institutions, the political institutions, all hands have to be on deck. And for us as development partners, we also now come to provide support, provide international best practices, bring on technical expertise and a little bit of other supports just to make sure that the child grows, survives, thrives, and then participates and contributes. Because at the end of the day, it's the child you have today that becomes your human capital tomorrow that drives development.
According to UNICEF, in 2020, about 5 million children under the age of 5 died, largely due to preventable causes. To reduce such alarming number, certain measures should be put in place.
Every child has a right. It's not a privilege, actually. It's a right. And we must reach every child wherever they are, in whatever conditions they are. And that is why UNICEF, as well as others, continue to work even in the world hardest situations, in emergencies, in the front lines, to ensure that those children live, survive, and thrive, because children will still have to contribute. So for Lagos here, Lagos has got it right in so many areas, but then we begin to look at where are those children who are really not reached? How do we reach them? Because here you'll be surprised that there are still children in Lagos that has never taken even one dose of immunization. So we must reach all those children. Then there are policies. Right now, Lagos State government is developing its Lagos State Development Plan, which is going to cover 2022 to 2052. You understand? So with that, we have to also ensure that Lagos, the mega city, is a city that is fit for children. Is a city that has taken cognizance of persons living with disability. Is a city that has taken cognizance of all the children, and not only children, but society. But we focus on children because it's the children. If we catch them at the right time, then we are more confident that in the future we'll have more children. We'll have a robust base of human capital that can drive the economic growth, which translates economic development.
Child survival is an important factor in ending poverty, stabilizing the economy, and securing the future of a nation. Every child has a right to survive. Thank you so much, Mohammed Okori. If you watched that report, there was emphasis on what we should be doing, especially in terms of ensuring that the children get the right immunization at the particular age they should get it, all right? Moving on, our next report is on medical checkup. Achoze Elizabeth was able to identify the benefits of regular health checkup. Let's see this together. We'll be right back.
The importance of regular medical checkup cannot be overemphasized. Reason is, know that even if because of the harsh economy, they say health is wealth. Without you being healthy and you are complaining of the economy, is it when you are being hooked up with some diseases that can be preventable? Is it when you are going to say you are that time you're running helter-skelter, putting your loved ones into high financial pressure? So it's better for you to do regular health checkup, for you to detect those ones that are some diseases or illness that are asymptomatic, that are asymptomatic. They don't show any sign before they come, especially like hypertension. When you are hypertensive, you may not know. Some people may not know that they're walking around. But when they have one issue or when they come for screening, that's why we always emphasize that wherever you see some health or non-governmental organizations that are organizing free health check, just go, avail yourself to go there. Even if you don't have money, you can go there to know your health status. By you knowing your health status, you'll be able to address those issues that is unknown to you, that you are having it, like high BP. Some people that are working cops, they may be going around saying, if you tell them, no, you are sick, they say they are not sick because they're not having headache. No headache, no fever, nothing. Nothing that will make them to say, I'm ill. Except when the thing has hooked them, then either they collapse. Maybe some people, even the healthy ones, the educated ones, you will see them when they are driving, they slump and die. That's because they don't, maybe they're hypertensive, they don't know that they are sick because they did not know their health status, especially the BP. If you have the one that checks your BP regularly, you will be able to detect when your BP is going haywire, going high, and you take your drugs, go to medical facility to seek for help. They'll prescribe drugs that will keep you going. So that's the essence of regular medical checkup. If you don't check yourself to know your health status in the area of high blood pressure, you may think that all is well. When you are driving and maybe driving on the wake up, you feel unhealthy, maybe you're having a headache, you say, take paracetamol and go. On your way to your workplace, maybe the traffic, maybe because of pressure or stress, you can fall out, you can fall. That's why you see some people on their way to work, or they can slump on the way, on the roadside and die. And you know, if those are preventable things. If you are having regular medical checkup, you can know that your BP is high, and you take your drugs immediately. And also, if you are the type that can afford it, you can have your BP monitor at home and check yourself regularly. When you have that one at home, you don't need to have fear. Well, that's part of maintaining regular health check. Then of sugar level, you know, these symptoms can be hidden and unknown to them. Like somebody that has high sugar, diabetes, either our food, what we eat junks, we eat anyhow. The person might not know that he's having high blood sugar, and on the long run, is eating anything he sees. And in the long run, maybe the sugar level is very high, and when you see the collapse at home, maybe that the person might not be having frequent urination. Maybe because they say some people, when they have sugar, they'll be passing urine. It's not only sugar, high sugar that can make you, infection can also make you pass. But just go and find out go out for regular checkup. You know whether the frequency urine is due to sugar or infection or bladder irritation. Those are the things that will make you to know, guide you how to go about your illness and take proper care of it. Also, that cholesterol. Some people may think I'm always having tightness of the chest, this and that, but I don't know. There was and they would seek advice from their colleagues, from their neighbors. They are having tightness. Why can't you go and seek for medical help? Go and do medical checkup to know whether the tightness of the chest is due to congestion of the heart, due to high blood pressure, or due to congestion of the heart due to fat. The cholesterol, it can trigger. It can even lead to heart failure or heart attack. Those are the things. When you go for regular, they will tell you your health status. Then you'll be able to take care of yourself, and you can prevent preventable deaths. There are some deaths that can be preventable due to from the outcome of regular medical checkup. That's the essence of it. They say prevention is better and cheaper than cure. So when you are doing regular medical checkup, you'll be able to keep yourself healthy and stable health, and live a healthy lifestyle, and also live long. Longevity is the hallmark of living, having this regular health check, at your own disposal.
Oh, that was an interesting interview with Achozi Elizabeth. I know that in this climate, one of the things that we do is we go to the hospital when we are sick. We go to the hospital when there's something wrong. It shouldn't be like that. And from that interview, you were able to pick, at least if for anything, pay attention to the consequences of not getting regular health checks, And moving on now, what you should be doing is to ensure that for the rest of the month of the year, you take your health seriously. And if there's any issue, please see a medical practitioner. Thank you so much once again, Achozi Elizabeth. Moving on, we have something on menopause. Dr. Mosumola Dosumu did justice to this particular topic. Let's see this together. We'll be back in a moment.
On average, people reach menopause at the age of between 50 and 51. Reach menopause, not that menopause starts at that age. Most people, the people on the roadside, you ask them what is menopause, and they tell you what they understand is when a woman does not see her period. Menopause is beyond that. Menopause starts from when your body system starts to change. Menopause simply means systematic body change. And when this body system is changing, it happens to both men and to women. Most of the time, your body system starts to change from maybe like 38 and above. My body system started to change above when I was 42. But you see, my mom never told me about menopause. I didn't know what to expect about menopause. I didn't know anything about menopause. So when my body system was changing, I started to panic. I didn't have any hand to hold. I didn't have anybody to go to. I couldn't even go to the hospital. I thought maybe I had a form of sickness and disease, and that is what most women out there are going through. But right now, the story is changing. There is a hand to hold. There is a community that you can belong to, so that you don't walk on this journey alone. Walking on menopause alone can be very stressful. Sometimes it could be medical. Most times it could be medical. Sometimes it's hereditary. When we're talking about normal signs of aging, let's break this down. Menopause has 3 different stages. You have the perimenopause. Well, I'm already 53, and I'm still not in menopause. And then a friend of mine, a much younger friend of mine, she is 47 now. She's in menopause. And she started this menopause journey when she was 38. By 37, she had finished having children. And when she was 38, her period ceased. She didn't even know when her body system started changing. But by 38, her period ceased. And she has not seen her period from 38, and she's 47. This is like more than 10 years ago. But I've seen my period twice this year, which means at 38, she wasn't already in menopause. I'm 53, and I'm not in menopause, but I'm in perimenopause. But you see, when you have an understanding, you should be able to tell yourself that I'm in the perimenopause stage, I'm in the menopause stage, or I'm in postmenopause stage. So it's not really age-related thing. And then when you go through this hormonal imbalance at an earlier age, I've seen younger girls, maybe 24, 30, having issues with their hormones. They need to see the doctor. This can be associated, it could be linked to polycystic ovarian syndrome, anything that has to do with hormone imbalance. Please see your doctor. Your doctor will carry out so many tests and be able to tell you this is not menopause, this is medically related. There are more than, don't get scared, there are more than 64 signs and symptoms. Let me explain this to you. Once the estrogen level starts to go down, it affects every tissue, every organ, every system of your body. So every part of you is being affected. The first thing, the most of the time, you notice, well, that wasn't what I noticed when I was going through mine. The first thing I noticed was my mood change, and that was what my children noticed, the mood change. But you see, for most women, what they notice first is their period changing, and that is the perimenopause stage. During the perimenopause stage, you will notice that your period drops from 5 days to 3 days to 2 days. You have to be sensitive enough to know that. Once your body system starts going down, your period starts dwindling like that, you should know that my body system has started to change. Don't panic. What you need to do is to get knowledge. You can get knowledge from the Meno Club. Then secondly, sometimes instead of your period coming down, your period increases. You start seeing your period twice in a week, twice, 2 times in a month, or even 3 times. Or your period goes from 5 days to 10 days to 14 days. That one can be very dangerous. You can't handle it. You can handle the first one, but when it comes to your period, going up because you will be getting tired. You can faint. So many negative medical issues can occur. Please seek a medical attention. Number one, you must be enhanced with knowledge. Once you're going through menopause or perimenopause, you have to be able to self-assertiveness. Know that this is what I'm going through. Then make fun of it. Make fun out of it. Let the people around you know what you're going through. Let me give you an example. I have two wonderful boys. And when we discovered that, okay, mommy's system has started to change, they were the ones that made me realize that I needed help because my mood changed. And then I started going through depression. I made my children understand that this is what I'm going through. I need help. And then once, because they now have an understanding, once I can call my first son, the second son's name, I'll call Richard Ronald, call Ronald Richard, and they'll say, Mom, are you okay? And I tell them menopause things, will laugh over it. Or I get home, I forget things, and they say, Mom, are you okay? Menopause things, and then they get to understand. For husbands and wives, you don't have to cheat on your wife. All you have to understand is, oh, this is what my wife is going through. Oh, she doesn't have feelings for sex anymore, or her mood has changed, she's cranky, okay, she can't help me for breakfast, lunch and dinner. Come on, man, you go to the kitchen and help yourself. If you see that your wife is tired, she's weak, help her. We need support groups at this stage. Without the support group, going through menopause can be very, very dangerous, and it can be lonely. Okay, I will advise every woman, if you're 35 and above, this is the best time for you to get enhanced with knowledge. And then it's good to know that there's some herbal supplements that can help to balance the menopause. Some of these are ginger, turmeric, honey, black pepper. If you blend everything together, add hot water and 5 ml of honey to taste. You take this a cup full in the morning, a cup full at night, you're fine. It helps to balance your hormones. I don't encourage hormone therapy. I don't encourage that because of the side effect of those hormone therapy. But if you take this fresh fruits, take fresh fruits, change your diet, exercise.
It's been an interesting time on Health Watch today. A big shout out to everyone that contributed to this production, to my director, to the production team, to the engineering team. Thank you so much for ensuring that we come on air every week, having a smooth production. And to all the medical practitioners, thank you so much. You have questions, you have inquiries, please reach out to us on akibenkem@gmail.com or send SMS to 07060865487. Remember that I normally say health conscious people live longer. My name is Nkem Okibe. Join us same time, same station. See you then.
Want the